Thank you, Cancora. Minister, there has been a welcome increase in the number of personnel employed by the HSE over the last 2 years, and I presume some of those people have been recruited through international recruitment campaigns. I know from working with some of the advocacy groups, people who are outlining the need for better services for children with a disability, that they are very anxious that additional therapists be recruited, and apparently they're not available here in this country or in our neighbouring island either. So they have been very strong advocates that we should be recruiting internationally for speech and language therapists, for occupational therapists and for physiotherapists. Thank you, Cancora.
Thanks very much, Deputy, and can I thank the Deputy for raising what is such an important issue in recruitment generally for health and social care professionals, for the therapists, and as the Deputy quite rightly says, in the area of children's disability services. I want to acknowledge that recruitment is very challenging at the moment, particularly as we're dealing with the effects of the global pandemic. However, it is worth noting that over the last 2 years, we have seen the top 2 years in terms of recruitment in the history of the HSE. Now, there is a lot more that needs to be done. There are many hundreds of posts have been sanctioned in disability services. Those posts need to be filled, and in fact the quickest way to making sure that every child gets the assessment they need and gets the treatment they need, and I know the Deputy Rabbit is working on this literally every single day to fix this. The single most effective thing we need to do is we need to hire those therapists. We have sanctioned hundreds and hundreds and hundreds of posts around the country which are not yet filled. As they get filled out, there's going to be a very substantial increase in the number of therapists available, and it's going to make a big, big difference. And we've got to get these waiting lists, ultimately, we've got to get them down to zero. No child should be waiting for an assessment. No child should be waiting for therapies. More broadly, since 2019, the workforce has grown by nearly 15,000 whole-time equivalents. It's continuing to grow at an unprecedented rate, and it's on track to grow by about 5,500 whole-time equivalents this year. That's about a 4% increase in just 1 year. To put it in context, the workforce grew by about 2,400 whole-time equivalents since the end of last year. And I'll come back on that.
Deputy Smith.
Thank you, Cancora, and thank the Minister for his response. Minister, I'm very glad that you have indicated particular concern in regard to the lack of adequate numbers of therapists to deal with children who have additional needs and who have a disability. Indeed, I have been engaging with Minister Rabbit on the particular problems in my own Cavan, Monaghan area. And again, we had legislation in this House recently in regard to ensuring that children with additional needs get a placement in schools, in appropriate settings in schools. And we're all aware that in many instances, delays in getting assessments for those children deprives those children of the appropriate placement in schools. So it's absolutely essential that assessments take place in a timely manner and that the follow-up treatment and therapies, if they're needed, are put in place at an early date as well. We know many families who are buying services, who can not afford to do it, but they're doing it for the sake of their children. And Minister, I cannot emphasise strongly enough the need to ensure that as many therapists as possible are recruited to reduce considerably the unacceptable delays that exist in places like Cavan and Monaghan at present.
Minister, please.
Thanks, Deputy. Specifically for children with disabilities, there's 2 different groups who are providing the service. So one is the Community Disability Network teams through the Progressing Disability Services strategy, and the second is what we would see as normal primary care teams. Now, the primary care teams, we were talking where the hundreds of vacant posts are that they are being filled, but we need to fill them as quickly as possible. That's the Progressing Disability Services. In primary care, I'm delighted to be able to say that we've sanctioned 3,500 staff right across the country in enhanced community care programmes. Over 1,600 of those have now been recruited, and over 500 more are at an advanced stage. In your own area, Deputy, CHO1, including Cavan Monaghan, nearly 80% of the allocated new development posts have now been filled.
Deputy Smith.
Yeah, and I think that was, thank you again, Minister, for your reply. And I think the recruitment in the Cavan areas, particularly in regard to the enhanced community care programme, which I attended the launch of it with yourself at Listarden at Cavan General Hospital recently. And I compliment the manager of the hospital, Suzanne Callahan, and the manager of services for the elderly in Cavan Monaghan, Rose Mooney, where they've put a great system in place that the General Hospital and services for the elderly are working together to bring as many services as possible nearer to home for people who need them. That's particularly beneficial for older persons. Good progress has been made in that regard. And again, in regard to children with a disability, we have to ensure the priority is attached there. I have another question later on. I don't know if it will be reached or not, but it has been represented to me as well that as a country we should be employing more therapy assistance. And apparently that works very well Deputy. In Britain. So hopefully, Minister, and I know it's not the remit of this particular question, but maybe it's an area that should be given some further consideration. Thank you again.
Thanks, Deputy. It's certainly something that can be looked at, and there's a lot of different areas, like advanced practitioners in health and social care professional grades are being looked at as well. So there's a lot of innovation being looked at. And then just going back to your original question around international recruitment. So we are supplementing the national workforce through international recruitment across several professions. The recruitment of doctors from overseas has obviously been a long feature, has long been a feature of HSE recruitment. But in addition to doctors, last year there were also about 1,000 nurses recruited from the international market. And so far this year, an additional 650 nurses have been recruited into posts both in the hospitals and the community settings. So there is a strong international recruitment campaign underway.